for the hospital's impending operation and opportunities.
Hello,
amazing people. Welcome back again to my channel, Theater UJTV, aka Mami Ekwa in the building. So thank you guys for always watching my videos. So today I'm here to, compare. Those things, I think I'm going to be doing more of a comparison videos because I have a lot of things to say about the country, Nigeria and Ghana. And I know my Ghanaian people, don't mind the comment section and tell me stop comparing. I have to because I'm a resident in this country. So I will have to talk about this. So let's move down to the health sector. Yes. And I'll be showing some clips or videos of the Nigerian health sector and the Ghanaian health sector. I'll be discussing a lot about it on this video. So if you've not subscribed to the channel, please subscribe. Watch this video to the end. Please don't skip my ads. Watch all my ads. All the ads you see here, please don't skip any ads you see here. Ads are the advertisements you place on my videos. Please do not skip. It is where I earn money from to recharge my phone and put out content here for you guys. So today, let's dive right into the video. But first of all, let's take a look at this hospital in Ghana. Being a beneficiary here in Ghana, I've benefited from the health care system here in Ghana, and I have a lot of things to say about this one when it comes to healthcare related issues. A lot of people that do not know, and if you're not aware that Ghana has this health insurance card, that covers most of your bills, even though you're a Ghanaian or you're a non-Ghanaian.
This is my Ghana card. Before, if you want to visit the hospital, you will need a separate document to visit the hospital. But you see, to me the Ghana card acquire Sabia, and one say so Ghana card now. Call NHIS office or mobile linky with previous national health to your Ghana card. Into here say Ubefa national health insurance acquire Sabia, and one is so do Ghana card Nico or mobile show.
This health insurance card covers most of your bills. If your accumulated bill in the hospital is 10 cedi, they are going to divide it into two. Maybe the government will take the bigger share and you will take the smaller share. And that makes it so easy for the people to access medical facilities here, for the people to access the government hospitals, the private, or even the private hospitals here in Ghana. If you have your Ghana card, they are going to remove some certain amount of money for you because you have this Ghana health insurance card. And ever since they brought up this Ghana health insurance, there are relief for a lot of Ghanaians and even people that are not Ghanaians that are residing in this country. It's been a lot of relief for them because when you think of the medical bills you're going to pay in the hospital, most people wouldn't want to go to the hospital. But here in Ghana, you go to the hospital, you benefit from the healthcare insurance service, you benefit a lot from the hospital because the government are paying half of your hospital bill. Now, when I look at this in this angle, I would say when a country is functional, when the government of the country is so intentional about the people, they tend to make everything so easy for the people. They tend to make everything so easy for the people. Cost of living, way of life, healthcare, education, and a lot more. They tend to make it so easy for the people because they wouldn't want the people to pass through, stress for them to be able to access the hospital. They wouldn't want their people to spend so much money for them to get the basic things like the healthcare service in the country. And what is the need of governing a country or being the leader of a country and your people are not benefiting from the healthcare, like the basic things? They have the basic things that the government needs to supply to the people. The basic things are healthcare, water, good road, education. All those things are the basic things the government needs to provide for the citizens of the country. And when I came into Ghana as the first time, I saw all these things that even water, where you live, the government provides the water. All you need to do is pay water bill, and it's not outrageous. A country that have the mindset that the people need to be conducive is a country that is worthy of emulation. Because if a country does not have those basic things, Nobody will want to come there. People will begin to complain from morning to night. People will begin to travel out of the country and go to some other advanced country that can be able to provide those basic things for them. But Ghana as a country, I've seen a lot of Ghanaians, they do not like traveling out of the country. Of these basic things that they need as citizens of this country is being provided for them. That is the reason why you see that most Ghanaians do not, just as in take that urge in traveling out of the country, even when they want to travel. I'm not in any way saying Ghana as a country is a perfect country, because their people still want more. There are still things that still need to be put in place in this country that the people of Ghana want that you do not know. But me, I am talking about this from the perspective that, okay, the healthcare service that I have seen is okay. The education that I have seen is okay. The road, they are constructing the roads. If you should go to Carnish, there are some roads that are being constructed in Carnish. The head bridge are being constructed. You go to Kumasi, you see a lot of this construction that are being done. I am not in any way trying to be political about this. No. I don't know any political party here in Ghana. I am not campaigning for any party here in Ghana, but I am talking about this based on the development that I am seeing in this country. So don't come at the comment section and start dragging me that I'm talking about a particular political party of which I don't know any. So now I've talked about the healthcare, and you see this video on your screen. I've been sharing the videos of these health facilities that are in Ghana, just one of them. There are other healthcare facilities that are in Ghana that you as a citizen, no, you as a non-citizen do not know, or you as a viewer that do not reside in Ghana do not know about. The health insurance have made a lot of things easier for the people to access the medical. Let's move down to the healthcare system in Nigeria. To be very sincere with you guys, a lot of you would know that those are in Nigeria, to be very sincere, would know that to access the hospital in Nigeria is accessible, yes, but having health insurance card that covers most of your bill in Nigeria is nothing. It is only those that are opportune to work with the government that are able to get this health insurance card to access the government hospitals in Nigeria, and those that can be able to afford to pay some health insurance company that can be able to afford the health insurance card, or the health insurance company would cover most of the bills in any hospital you go to in Nigeria. Most people cannot be able to afford most of these hospital bills. So that is the reason why most of them do not like going to the hospital, because they believe that, when they go to the hospital, the bills are so much. But to be very, very sincere with you guys, the general hospitals in Nigeria are quite affordable to go to. But the problem there is that most times when you go to these general hospitals, you wouldn't get the doctors on seat. Most doctors wouldn't get them on seat sometimes. And when you even get them on seat, the way they will attend to you like they are not being paid well, the way they will attend to you would, it will trigger you up. And that is the reason why you see most people in Nigeria, they prefer to go to the private hospitals, to take their deliveries or to be attended to than going to the general hospital. If I am wrong, please come and quote me wrong in the comment section.
So this was the hospital Professor Shibajo, the Vice President of Nigeria, actually had his surgery. So remember, not all political persons actually travel out of Nigeria for medical tourism.
I am not saying this in a place of hate for my country, or I am saying this to bring down my country. It is based on what I have experienced as a Nigerian. That is what I am saying in this video, because most times people do not want to access the general hospitals because of the nonchalant attitude of most doctors. I am not in any way saying the doctors in Nigeria are not qualified. And to be very sincere, Nigeria as a country has they have the best doctors in the world. In Africa, they have the best doctors in the world and in Africa. Because if you should travel out of Nigeria and to some places like the US, the UK, most of the medical doctors there are Nigerians. And you see Ghanaians, you see some other African countries that are doctors in those countries. I'm not in any way saying they don't have qualified doctors, but the nonchalant attitude of most of the nurses in those general hospitals are making people not to visit the general hospital. They would rather go to the private hospitals to pay. Hospitals in Nigeria still need proper maintenance also. They still need to work on the system. Like when it comes to healthcare system in Nigeria, the government still needs to look into the healthcare system in Nigeria because
Okay, guys, let me use 1 minute of my time to appreciate this General Hospital, Alimosho General Hospital, Igondo. You can see my voice is now back. My voice is clear. This hospital is one of the best hospitals for real. Like, the doctors are so nice, the nurses are so nice. This place is always neat. They will clean this place morning, afternoon, and night. They will give you breakfast, lunch, and dinner. This is the doctor that performed my surgeries on suits, Dr. Ahmad and his fellow doctors. So this is one of the nurses. She came to give me my injection. This place is just the best for real. This is when I used to go for my SOPD. God, if you are going to General Hospital, you need to be very, very patient because the crowd, they choke. But once
you need to work on the people, the doctors. And right now, there's shortage of nurses and doctors in Nigeria because a whole lot of them are jackpot. When I mean jackpot, a lot of them have left Nigeria to some other advanced countries like Saudi Arabia. They have gone to the UK, they have gone to the US because most of them said they are being underpaid. Allegedly, like they said, that they are being underpaid. That is the reason why they are relocating out of Nigeria, the medical doctor as nurses down to the UK, to the US, to Saudi Arabia because they want to be working and getting the money they are working for.
Immediately after housemanship, we noticed that most doctors, because of greener pastures, there is a capital flight from Nigeria abroad to UK, America, and all that. Now, government has invested so much money in training these medical doctors. So, if you realize, if they can now take advantage of our situation,
if you're a doctor, there's no reason for you to be in Nigeria. Almost 90% of the people I went to school with have left the country. There's something about being a medical doctor that Nigeria is really failing at. If you go to other countries, Western countries, there's this huge amount of respect and there's a care that's given to medical doctors that we do not have here. The fee is very bad, the living conditions very bad, and if you break down what the government is giving to the doctors in the country here, it's really bad.
Most medical doctors in Nigeria, a lot of them allegedly, as I said, they are underpaid, they are not paid well, and that is the reason why when you go to these government hospitals, the way they will attend to you, as they say, the way they will attend to you is something I don't understand. Because me down here, I've experienced the healthcare system in Nigeria. That is the reason why I could be able to talk about this. But Nigeria as a country, they have qualified doctors, they have qualified nurses that when you see them, you know what prescription to give to you as that is based on your sickness. But the issue is that it's just poor maintenance from the government. The government still needs to, work on the hospitals, the facilities, bring in more facilities that will help, foster the healthcare system in Nigeria. Because I've seen a lot of people, when they want to do some surgeries, I've seen people come down here to Ghana, Nigerians, because they believe that Ghanaians have this equipment that will help for their surgeries, But they also have some private hospitals in Nigeria that have this equipment, but how much is it? It's outrageous for just the poor people. The poor people cannot go to the hospital because if you're to go there, you can't be able to, pay the hospital bills, and there is no health insurance card that covers most of this hospital bills in this private hospitals in Nigeria. But the government still needs to do affordable for the poor people that can't be able to afford to go to private hospitals, can be able to go to, the government hospital take care of. There's some hospitals in Nigeria like the Luth in Nigeria, the Luth hospital in Lagos, it's crowded because when you go there, a lot of people are there waiting for the surgeon, a lot of people are there waiting for the doctors, pediatricians, and a whole lot. They have the equipment in Luth, but people are much. The people that going to the hospital are much. And most times you go there, you get a card, to see a doctor, you stay there the whole day. You might not see the doctor that day, you have to come back the following day. The people are much than the equipment that they have.
Notice that there is heavy decline on medical brain drain. From 24,000 to now, as I speak, we have less than 10,000 doctors in Nigeria. So that is alarming.
So the government should try and make sure that every country, every hospital in different states have, this equipment that can be able to help the citizens of Nigeria when it comes to health-related issues. But here in Ghana, they have the health insurance card that covers most of the bills in Ghana. So I think Nigerian government should also implement it, look into this and implement the health insurance card for the people of Nigeria. It shouldn't just be for the government workers. Let it be made available to all citizens of Nigeria so that they can be able to access the healthcare service in Nigeria and get to pay a token. People, when they are sick, they can be able to go to the hospital. Instead of people doing self-medications, and after everything, a lot of them will lose their life because they are trying to, do self-medications for themselves. Because when they go to the hospital, the bills are much. But some hospitals in Nigeria, the government hospitals, are cheaper, but there are still some people that cannot afford to pay the hospital bills. I don't know anything about this video. Please give the video a thumbs up, like, comment, and share. If you've not shared this video, please share with your family and friends. And don't forget to turn the post notification so you get notified whenever I post amazing content. See you favorite girl, UJTV, aka Mami Ekwa in the building. Every time Mami Ekwa on the spirit of YouTube, you know what it is. So see you guys in my next video. Bye.